About 2 months ago, I broke my favorite pair of glasses. They were the best glasses. I've had them for 10 years. I've had the lenses changed out twice in them. I even wore them when they had cracks. My vision, as Dr. Wang said, was very, very poor, and the glass just kept getting thicker and thicker over the years. And but these were the best Oakley glasses ever, and they fit my face so well because I didn't have to do this all day. So I broke these glasses about 2 months ago, and I had nicer, newer glasses, and they cost to get the type of lenses that you want to kind of make them real thin and look nice. They cost a significant amount of money, and I put them on my face, and they just kept sliding off, and it would just frustrate me. And one day, I just got so frustrated. I said, I've got to do something about this. I'm 37 years old, and my optometrist back in Nashville, Tennessee, told me that I would probably be a good candidate, but I didn't need to wait. I need to go ahead and do it. The younger I do it, the better. And so I thought, well, I got to do something. And everybody in Nashville, I live in just outside of Nashville, knows about Dr. Ming Wang. I mean, from everything that you see in the news to endorsements and all the philanthropic stuff that he does with his foundation. And so everybody knows he's the best. And when you're talking about your eyesight, I thought, well, I'm just going to go ahead and see if I'm a candidate. And I was expecting to not be a candidate because my vision was so poor. And I came here. They ran a battery of tests, and I've been wearing glasses ever since I was 7 years old. I thought I experienced every test that they could give me. And by the end of it, I thought, well, he's going to tell me I'm sorry. There's nothing we can do for you. And sure enough, he told me that he was 95% sure that he could correct my vision without glasses. I thought, get out of here. 95%. I'm a nurse by profession. I deal with surgeons every day. And if a surgeon told a patient, we're 95% sure we can remove that tumor, on my professional advice, I would take it every time. But we're talking about your eyes, and we're talking about how sensitive they are, and what if something goes wrong, and all the things that mount up, and the fear just started escalating. Oh, I'm a candidate. And then you think about the financial, and you think, oh, how much would you pay to be able to see without glasses for one day? Would you pay $100? I would do it. I mean, every time I woke up in the morning, the first thing that I did was reach for my glasses. And so I got to thinking, this guy's the best. He's and no, he's not paying me in pizza or anything else for saying that. I am truly honored to be here before you to share you my story. All these questions started mounting up about what I should do. And I called my wife and said, look, I'm a candidate for this surgery. And she goes, well, do you really want to do it? I said, I don't know. I'm scared. I didn't feel like I was prepared. I was expecting to be told no. And it was just fear. And I wound up thinking, cost is not an issue. These are my eyes. See, what you don't know about me is that I was diagnosed with a rare form of cancer about 1.5 years ago. I have overcome that, and I have a new lease on life. So these are the only eyes that I have, and I probably won't have them as long as most people will. So I decided to do something about this. But I just wasn't sure. And he said, I got his packet in the mail, and I looked at it, and for months my mom has been on me about watching this movie. And she kept saying, Brian, you need to see this movie, you need to see this movie. And I thought, oh, I'll see it. Well, she called me. My appointment was on Friday night, Friday morning. And Thursday night, before I go to bed, I generally talk to my mother. And she said, well, I'm coming down Saturday. I bought the movie, and I'll show it to you. I said, oh, okay, great. Well, when he presented me with the option and said that I'm a candidate. I thought maybe I'm not informed enough. I carried my packet with me. I think I've seen some of you with the packet, and got to looking at it. And there's a small photocopied insert about the movie God's Not Dead. And that's the movie my mom has been hounding me for months to witness. And I was looking for every bit of information, something to just educate me, tell me, help me make a decision. And I saw that photocopied piece of paper, and I got to reading it. And I'm not a big science person, but Dr. Wang was the inspiration for one of the characters in the movie, and got to meet with the actor, and I was blown away. And like I said, I'm not a science guy, but this is the providence of God. That right then and there, I decided to do it. And guys, I'm 3 weeks into this, and I can just cry because I can see. I'm telling you, this is reinvigorated my life. I'm taking a chemistry class, and I'm the oldest guy at Ball State in the chemistry class. But I can sit in the back and read the board. I've never been able to do that, even through middle school and high school. So this was a big change in just my whole lifestyle. And I apologize for running on about this, because he probably just wanted me to say, tell about my experience. And he prayed with me right before he did it. He called me at 10:52 at night to make sure that I was doing okay. And guys, it's been the best experience. And if I knew back then what I know now, I would take a gun and make you do it, because you would love me for it. So anyhow, Dr. Ming Wang, thank you so much. You are, besides all the stuff that you do in science, you are a hero to many and a hero to me. Thank you so much for giving me this opportunity to speak.
Thank you. Appreciate it.